total coverage. A good number of the people who are uninsured can afford it and choose not to do so. A good number of people are eligible for government assistance.
Governor Romney's system has mandates in Massachusetts, although you've backed away from mandates on a national basis.
No, I like mandates. The mandates work.
Beg your pardon?
Here I
didn't know you were going to admit that.
No, absolutely.
You like mandates.
Let me tell you what kind of mandates I like, Fred, which is this. If
the ones you come up with.
Here's my view. If somebody can afford insurance and decides not to buy it, and then they get sick, they ought to pay their own way, as opposed to expect government to pay their way. And that's an American principle. That's a principle of personal responsibility. So I said this: if you can afford to buy insurance, then buy it. You don't have to if you don't want to buy it, but then you got to put enough money aside that you can pay your own way. Because what we're not going to do is say, as we saw more and more people in this country doing,
you impose tax penalties in Massachusetts.
Yeah, we
say, look, buy it.
If people can afford to buy it, either buy the insurance or pay your own way. Don't be free riders and pass on the cost of your health care to everybody else.
The government is going to make you buy insurance.
No, the government's going to stop.
I mean, the state, your state plan, which is, of course, different from your national plan, did require people to make that choice, though. The state required them to do that. What was the penalty if they refused?
They refused to pay your... Let's go back, Fred. What's your view? If somebody...
Well, I asked the question first.
No, okay. Well, I'll answer your question, you answer mine. If somebody is making, let's say, $100,000 a year and doesn't have health insurance, and they show up at the hospital and they need a $1,000 repair of some kind for something that's gone wrong, and they say, look, I'm not insured, I'm not going to pay. Do you think they should pay or not?
Did your plan cut people off at $100,000? Was that the level?
No, actually...
Did it only apply to people with $100,000 income and over?
It actually applies to people at 3 times federal poverty. They pay for their own policy. At less than 3 times federal poverty, we help them buy a policy, so everybody is insured. And everybody is able to buy a policy that's affordable for them. And the question is this, again, if someone can afford a policy and they choose not to buy it, should they be responsible for paying for their own care, or should they be able to go to the hospital and say, you know what, I'm not insured, you ought to pay for it. What we found was 1/4 of the uninsured in my state were making $75,000 a year or more. And my view is they should either buy insurance or they should pay their own way with a health savings account or some other savings account.
We have an expression in television, we get in the weeds. We're in the weeds now on this. But let me just come to one point. Yes or no, in your national plan, would you mandate people to get insurance?
I think my plan is a good plan that should be adopted by other states. I wouldn't tell every state.
Would you mandate?
I would not mandate at the federal level that every state do what we do. But what I would say at the federal level is, we'll keep giving you these special payments we make if you adopt plans that get everybody insured. I want to get everybody insured. In Governor Schwarzenegger's state, he's got a different plan to get people insured. I wouldn't tell him he has to do it my way, but I'd say each state needs to get busy on the job of getting all our citizens insured. It does not cost more money.
I want to give Governor Huckabee a little time, then we got to go.
Okay, I think it's important to realize that the issue is not just insurance. The issue is that the whole model of our healthcare system is upside down. We really don't have a healthcare system. We have a disease care system. And the insurance model that we use, we act like that if we insured everybody, we fixed it. We haven't, because the real problem is that our model, both in the insurance model and the healthcare model, waits until people are catastrophically ill before it intervenes. And we really have to change the concept to a preventive focus rather than an intervention focus. And that means the entire system starts working on health and wellness, because 80% of the $2 trillion that we spend on health care goes to chronic disease. We could prevent it or we could cure it, but we don't. So it's not an issue of there's not enough money to cover people. But if a real health care system exists, it has 3 components. It has affordability, it has quality, and it has accessibility. And if it doesn't have those elements, it's not a system, it's a maze. And what we have in America is a health care maze. It's built on the idea that we wait until people are so desperately ill that the cost to try to fix them is catastrophic and out of control. And no wonder we have a system that needs major, major attention. And by the way, just out of due respect, you said $1,000 for a repair. It's about $1,000 for a Kleenex at a hospital anymore. And that's why we need to have a totally different system that keeps you from going to the hospital in the first place.
Charlie, a health savings account actually helps to accomplish what the governor is talking about. If somebody can put aside, and the plans that we've been talking about, include a health savings account. You'd have an exemption up to $15,000. If you could find a policy for $11,000, you could have a $4,000 health savings account. You would be able to buy some of your health care and your prevention yourself. It gives you an incentive over a lifetime to deal with wellness.
And I've got to go, but Senator McCain has talked a lot about controlling costs, and you bring up the issue in controlling costs. And all the experts say to me, look, if you're going to control costs, you got to do three things. You're going to limit access to technology. You're going to limit, in some way, change the reimbursement system for doctors and hospitals, or you're going to have to limit the amount of treatments. That's the only way we can bring costs down, and that's the third rail of healthcare. Which of you is going to touch any of that?
Charlie, that's not at all the way it is. The fact is,
in all due respect, I thought that question.
Yeah, it was directed to you. Yeah.
I think that there's additional choice here, a choice of having outcome-based treatment. There are 5 major diseases that consume 75% of healthcare costs in America. If someone has diabetes, we should give the healthcare provider a certain amount of money and say, care for that patient. And if at the end of that period of time, then, and that patient is well, we'll give you a reward, rather than every test, every procedure, every MRI. And we need walk-in clinics, and we need community health care, and we need incentives for home health care as opposed to long-term care. In my state of Arizona, we adopted a proposal which incentivizes health care providers to keep people in home health care settings, dramatically less expensive than long-term care. In Arizona, we have 1/2 the number per capita of people in long-term care facilities as the state of Pennsylvania. Incentives to keep costs down, Charlie. There are no incentives in the system today. Could I just mention one other thing? Both the Attorney General of South Carolina, I don't know why I mentioned South Carolina.
Because there's a primary there.
And the Attorney General of Iowa, and I don't, well, anyway.
That's too late.
have sued the pharmaceutical companies because of overcharging of millions of dollars of Medicaid costs to their patients. How could that happen? How could pharmaceutical companies be able to cover up the cost to the point where nobody knows? Why shouldn't we be able to re-import drugs from Canada? It's because of the power of the pharmaceutical companies. And we should have pharmaceutical companies competing to take care of our Medicare and Medicaid patients.
Okay, don't leave me.
Don't turn the pharmaceutical companies into the big bad guys.
They are.
No, actually, they're trying to create products to make us well and make us better, and they're doing the work of the free market. And are there excesses? I'm sure there are, and we should go after excesses. But they're an important industry to this country. But let me note something else, and that is the market will work. And the reason healthcare isn't working like a market right now is you have 47 million people that are saying, I'm not going to play. I'm just going to get free care paid for by everybody else. That doesn't work. Number 2, the buyer doesn't have information about what the cost or quality is of different choices they can have. If you take the government out of it to a much greater extent, you get it to work like a market, and we'll rein in cost.
I've got to call a halt. We're going to take a commercial break. We'll come back. I'm going to be joined by Scott Spradling from WMUR, and we're going to go to some more direct questions. Stay with us. The Republican debate continues from Manchester, New Hampshire.